Hello my people, welcome back to our second video of today, whereby we are still discussing about types, or we are still tackling this topic about sexually transmitted diseases. For those who have not subscribed, you are actually losing a lot. You are actually missing a lot of our education. So what I can advise is to subscribe, like, comment and share our videos, and you will learn more. So let's get back to our topic of discussion, whereby we will be discussing about types of sexually transmitted diseases. Note this: the list of sexually transmitted infections is pretty long. Thus, there are fewer Std'S. So the list of STIs which can lead to sexually transmitted diseases, the list of sexually transmitted infections is long or endless, but the sexually transmitted diseases are fewer. As we said before, some sexually transmitted infections can lead to sexually transmitted diseases. So this means that not all sexually transmitted infections can actually cause a sexually transmitted disease. I hope I'm clear on that. So they range from pelvic inflammatory disease caused by sexually transmitted infections like chlamydia and gonorrhea to some forms of cancer caused by human papillomavirus. Note this: if pathogens that cause the infection, end up damaging cells of the body and disrupting its functions, an STI will progress to STD. If pathogens that cause the infection end up damaging cells of the body and disrupting its function, a sexually transmitted infection will progress to a sexually transmitted disease. So let's discuss about the main sexually transmitted diseases. Number one, we have what we call PID, or pelvic inflammatory disease. Here, gonorrhea, chlamydia and trichomonas are common sexually transmitted infections that can lead to sexually transmitted diseases if left untreated. So gonorrhea, chlamydia and trichomoniasis are common sexually transmitted infections that can lead to pelvic inflammatory diseases if left untreated. Another point to note: not all cases of pelvic inflammatory disease are caused by a sexually transmitted infections, as other bacteria, but all bacterial infections can play a role in causing pelvic inflammatory disease. Another point to note: although this infection of the female reproductive organ is classified as a disease, although pelvic inflammatory disease is classified as a disease, some people have no symptoms for the same. That means they are asymptomatic or have no signs. Those who have symptoms experience the following: 1. Pelvic or lower abdominal pain. Number 2, pain during penetrative. This is the main point here. Penetrative vaginal sex, or when urinating. Number 3, they will have irregular heavy or painful vaginal bleeding. Number 4, they will have unusual vaginal discharge, which might be smelly, bloody, or brownish in color. Number 5, they will have nausea. Obvious, when you have a bacterial infection, you will have that feeling of vomiting. That is what we call nausea. And also they will have high body temperature. Wherever there is an bacterial infection, body temperature must rise. Note this, antibiotics can successfully treat pelvic inflammatory disease if diagnosed earlier enough. However, they won't treat any scarring on the fallopian tubes that may have occurred. So antibiotics might be successful, might treat pelvic inflammatory disease successfully if diagnosed early, but antibiotics won't treat any scarring in the fallopian tubes that might have occurred. This scarring can make an ectopic pregnancy or can lead a woman in getting pregnancy on the fallopian tubes, or the fertilized ovum won't implant in the womb or the uterus. So this scarring can make an ectopic pregnancy more likely, and also has been linked to infertility with around 1 in 10 women, or 1 in 10 people with pelvic inflammatory disease becoming infertile as a result. So this makes the end of our discussion today. In the next video, we'll be discussing the same disease, sexually transmitted diseases. Today we have discussed about pelvic inflammatory disease, but tomorrow we will continue our topic. Our first topic tomorrow, we will be discussing about tertiary syphilis. Tertiary syphilis. So let's meet in the next video tomorrow. Have a good evening. Let's continue subscribing, liking and sharing our videos so that they may reach as many people as possible. Have a wonderful evening.